Hi there. Okay, so this is just going to be a real quick tutorial on how to check your blood sugar. Before you get started, you're going to want a few things. You're going to want your machine, your glucometer. So inside your glucometer, most of these packs will have both the machine and what's called a lancet. This device that causes you to bleed is called a lancet. Okay. So you're going to want the lancet, you're going to want the glucometer, and you're going to also want your test strips. These are the little strips that you put inside the machine. You'll want a tissue and you'll want to make sure your hands are clean, good and clean. So before we get started, I am going to show you how to change the lancet needle if you need to do that. So most of all the lancets are different. There are hundreds out there. Each one's different. You're going to want to watch and see how your machine works so that you can change these devices out. So, but usually they come apart and you can see that there is the needle there, that small little fine needle you can see at the tip. You want to take this device out and you want to replace it. So you want to make sure you're not stabbing yourself with the needle, but taking the device. So usually they just twist out and they come out. So this is the removed lancet device. And then this is the spring-loaded device that you can see now does not have any kind of needle in it. Set this down somewhere safe that you're not going to stick yourself. Get a new device, a new needle, I guess. It's not a new device, but a new needle. These are how mine look. I also have some old ones. So these are blue ones. These are white ones. Maybe I could shove this one into the lancet device that I have now. I don't know, but these are the ones that came with the lancet device. This circular component I will twist off and it will expose the needle. Prior to doing that though, I'm going to put this into my device. You can hear the spring loading happen, right? So listen again. And you can push that, okay? What I'm doing is I'm pushing down on this. Usually what I do is pull on this device here to spring load it. But whenever you hear that happen, just redeploy that spring device, okay? Now I'm gonna twist this round cap off, and maybe it's gonna be different. All the ones that I have been round, but maybe it will be different for you. But there's something protecting the needle. One, that keeps the needle sharp. Two, it keeps it from hurting anybody. So we're gonna twist this off, and then you can see there is a new needle there. I'm trying to make it to where you can see it. There we go. A new needle on that device. Hold on to the plastic piece that you twisted off. You take your cap, you put it back on, and your device is now got a new needle on it that's nice and sharp and will be kind to your fingers. The sharper the needle on your lancet, the sharper it is, the kinder it will be to your fingers. So I'm repackaging the plastic packages that have the lancet device, the needle device in. So on this, I'm going to take this piece and lay it down flat, and then I'm going to push this into it so that it comes up capped. Then that device has been safely secured and you can dispose of it however you've been told to do so. So again, you're going to make sure your hands are clean. You're going to wash them. When I do my finger sticks, I do it on the outside of my fingers, not on the tips, because that's what you use the most. They get tender. I really stay away from my index finger because I use it a lot. I usually stick to these two and these two. And yes, I am proficient at doing it both ways. So once your hands are clean and your lancet device is prepared, you are going to take one of your test strips, okay? So the test strip comes out and it has two sides. It has a side where it collects this little slice, I guess, this little divot inside of it. It will wick up your blood. That's where you put the blood drop. This little part next there on the bottom that looks like a chip is a microchip, and it goes into your machine. This is what your machine reads as your blood sugar. So I'm going to take my machine out of the little case and I'm going to put microchip in, and you'll see my machine comes on. My machine comes on automatically. I think most machines do this. And you can see it's got a dripping, like a blood drop, waiting for the drop of blood that I'm going to put on this device, on this test strip. So I'm going to, okay, so I'm going to pull that back until you can hear it. You can see my name's on that. But there's a couple things about this. You can twist this. There's a device on mine. You can twist it to make it go deeper if you're not getting blood easily enough, or if it's going too deep, you can back off a little bit. But there usually is a depth measure or depth device that you can set the depth of the finger stick on. And then of course, again, you have your deployment button. Okay. So I'm going to pull mine back to set the lancet, the needle, and I'm going to put this device here. You can see it's like on the side of my finger. It's not on the tip. It's on the side. So I put it over onto the side and I push it flat and then I just deploy the button and it goes. Okay. So you can see initially you'll get a little drop of blood. Okay. That first, I always get that drop bigger. And then I wipe that first drop away. That's what you're supposed to do, is to wipe that first drop away. And then I just get another, gently squeezing, never hard squeezing. Okay. So there's a drop of blood here. And I'm going to wick it away with my glucometer. And you can see how it went all the way up into that little strip. And then I just hold it onto the tissue or the cotton ball that I bring. And then it will give me a reading, and 118. So I just ate my lunch of tuna salad about, I don't know, 45 minutes ago, maybe an hour ago, but either way. So 118 normal blood reading, blood sugar reading, even for a postprandial, for an after meal reading. So that is how you how you get your machine to work. Okay. How you stick your finger, how you get your machine to work. I want to touch base on a couple of troubleshooting things. If you are having a hard time getting blood from your finger, do not squeeze it over and over and over again. It can actually make the blood sugar higher, and it makes the blood sugar higher because sometimes it breaks the cells open. It can give you an inaccurate reading. So don't do that. The other thing that you want to maybe do if you're having a hard time getting blood from your fingers, say it's cold winter morning, whatever that is for you, whatever that reason might be, you can shake your hand. Shaking it will bring that blood to the tips. Okay. You can also wash it under warm water. That's going to get some good blood flow through there. If you do feel like you have to squeeze your finger a lot, or if you don't like setting that depth on your glucometer very deep and you don't want to get deep sticks, you can actually milk that blood to the top beforehand, but don't do it. Don't milk that blood to the bleeding site after you've already stuck it. Don't do it that way. If you're going to do it, milk it before you do the finger stick, and then get the finger stick device, the lancet device, and stick it and then get the blood that way. So hopefully this gives you some clarity on how to do that blood sugar check. Make sure you ask your provider how frequently and what times they want you to be doing those blood sugar checks. All right, I will see you in the next video. Bye-bye.